Communication is a critical component of cognitive and socio-emotional development. Language provides the basis for representing the world. It is the most effective medium for a child to convey personal and social needs, and it allows us to judge whether a child understands classroom demands. It is a basic prerequisite for accessing the curriculum. In 2018, speech and language impairments accounted for 19.5% of all children served ages 3 to 21 with disabilities. Children with speech and language impairments represent 2.7% of total enrollment. While it is not often understood why or how a person is born or becomes impaired by speech and language, there are a few possible reasons. Some of these reasons being hearing loss, neurological disorders, brain injuries, intellectual disabilities, and drug or alcohol abuse. There are also many different types of speech and language impairments, one being childhood apraxia of speech. This is a motor speech disorder in which the brain does not properly transfer words and sounds to the mouth. Intervention should start as early as possible. Not all people that have a speech and language impairment are born with the impairment. Aphasia and dysphagia are acquired language impairments due to the damage of certain parts of the brain. They can be caused by different types of injuries. However, aphasia is known to be more severe than dysphagia. Speech and language impairments are not always detected early and sometimes identified incorrectly. Sometimes misidentified as speech delayed or, on the contrary, identified as an impairment when in reality it's actually just a language difference. As educators, we need to be careful of this. Some identifiers to pay attention to while kids are young is their development and pronunciation of words. Can the child express him or herself? Is he or she able to take direction or properly respond? Does he or she get frustrated when trying to speak? There are many different aspects of speech and language development that adults should look for. It is important to understand that impairments vary from person to person. This communication disorder includes stuttering and difficulty creating or understanding sounds and words. These students often struggle with articulation, fluency, and voice. Please remember that not every person that has a speech and language disorder is nonverbal. Characteristics of speech and language impairments are difficulty making certain sounds beyond the average age, being unable to speak with fluency, having problems with pitch, loudness, resonance, or even quality of voice. There are many types of language impairments. Today I will only speak about a few. The first is a receptive language disorder. People with receptive language disorders have problems understanding and processing what others say to them despite having absolutely no hearing problems. Second is called expressive language disorder. This disorder causes problems with using words to express thoughts. Some may think that these people are unable to pronounce words, however, this isn't true. While they can pronounce the words if a person asks them to repeat, they are unable to think of the correct words on their own. This type of disorder is a mix of receptive and expressive. Some people are unfortunately unable to understand and process and unable to express their own thoughts verbally. However, while these students may be unable to express themselves verbally, they do still feel emotions, and we need to remember that. Argumentative and alternative communication is used daily by all people. AAC is all of the ways that people communicate without speaking. That includes writing, facial expressions, gestures, and much more. There are many different types of augmentative and alternative communication that is especially used with students who have a speech and language impairment. It's important to note that these students can easily become frustrated with not being able to express themselves. Therefore, it's a great idea for teachers to have some type of positive reinforcement readily available. Some things could be stickers, candy, or even toys. Using communication boards filled with illustrations of general and daily items can be useful in communicating with students who struggle with speech and language. These types of boards are pretty old school, but work effectively in allowing students to answer questions and express themselves with or without assistance. The only negative aspect of this strategy is that binders can become quite heavy. The alternative to old school message boards is finding and downloading an app that includes message boards. Using an app can make it much easier to communicate, as an iPad or iPhone is much lighter than a binder filled with images. This also makes it much easier to travel with and to always have on hand. Being in close proximity of students can also help them to better understand and to process what is being said. All people speaking to students with a speech and language disorder should speak clearly and pronunciate each word. And as we know, we should pretty much be doing that with all of our students anyways. Repeating oneself can also help students with understanding, memorizing, and speaking the words that they are trying to use. Depending on the severity of the impairment, repeating words while simultaneously showing an image of the word can be beneficial to the student. Speech and language pathologists can be a great influence and benefit for students with these types of impairments. Therapy sessions can be one-on-one, group sessions, and even in-class sessions in which the therapist pushes into the student's classroom to aid him or her in creating sounds, understanding, and properly pronouncing vocabulary. It is important to note that students with speech and language impairments often have more than one disorder. However, there are also students who do not struggle intellectually. It is important that teachers are patient and knowledgeable of their students and the skills and strategies that can be used to aid these students in being positive additions to the class and to society.